Executive Director John Roser from Scituate Community Television, and I'm here today with Jim Cantwell.
Hey, John.
Hello, Jim.
John, great to see you again.
To record another episode of State House Matters here at SCTV. How's everything been, Jim?
Things have been great, just incredibly busy.
We talked a little bit before the recording, and you said that things have been very busy with the Ways and Means Committee.
That's correct.
And my first question was, what exactly is the Ways and Means Committee?
Right. The Ways and Means Committee, for everyone watching for SCTV, everyone here would see what happens at our town meeting, and they'd know you'd look to the Financial Advisory Committee. It's folks who review the entire budget, work with the finance team, put a budget together. Ways and Means Committee is just that. It's the committee at the State House who puts together the entire $38 billion state budget. I was telling Liz Charlton off camera that I said the great news was I was appointed to be on the Ways and Means Committee. The bad news is I was appointed to be on the Ways and Means Committee. It takes a phenomenal amount of time. So over the last few months, I apologize, we missed one another for a few weeks because that has consumed really every waking moment, all the work that we are doing. But it's a great way to be able to see every line item that impacts people's lives. For us to work this year, we did really, frankly, a very responsible, lean budget. It's a budget this year that has no new taxes, no new fees, working well within what we believe, what's called the projected budget every year. We do a thing back in December called the consensus revenue hearing, where we meet. It was the governor's, incoming governor's staff, Governor Baker, working with the Ways and Means staff on both the Senate and the House. We had a number of economists come in and talk to us about what they projected revenues would be for the next year. That's how we come up with a number, and we say that's the revenue we're going to have to make sure that we live with. And then we did a series of hearings, John, you and I discussed all over the state, which is actually very interesting to be able to go all around the state, seeing different areas, what some of their strengths are, what some of the challenges are, and then to go through the budget line item by line item. So it's been a phenomenal experience and something that we have some examples, local examples of things that where we've been able to make a great difference.
It's good to know that someone who's representing both Scituate and Marshfield is on that committee and can see those things as they happen in real time.
Thank you.
We tend to talk about some of the serious situations and issues that we're facing here in Scituate and in Marshfield, and one that tends to crop up is the substance abuse issue. And
absolutely.
It's a complicated issue and something that affects a lot of people. And I always like to hear whatever updates you may have regarding this issue.
Sure. And it is the greatest public health crisis that's facing us, and the thing we want to stress time and again for folks, that this is a disease. In the past, I used to be a prosecutor. I was in the DA's office for almost 4 years, and I can attest to you that some 90%, John, of crime that is done in society, it's either has a drug issue or an alcohol issue behind it. This issue is not one that we're going to arrest our way out of the problem. It's going to require a comprehensive program and approach to try to address it. We are so fortunate here in Scituate. Anne Marie Galvin, Greg Ranieri, by co-founding Scituate Facts, it's become the leading organization in all of Plymouth County. Just had an all-day-long program yesterday where Anne Marie was one of the speakers out in Brockton. It went from the early morning right till the end of the day. She is like a rock star when it comes to people that are working in substance abuse prevention. And one of the things that we talked about, John, that I'm really thrilled to be able to announce here to folks watching in Scituate is we just created, just 2 weeks ago, a Plymouth County Substance Abuse Prevention Coalition that's largely going to use the success of Scituate Facts and try to make sure to bring it all around our county. And we had unanimous support of all our Plymouth County legislators. I co-chair this group with Senator Tom Kennedy, who's a state senator for Brockton. And we identified as one of our major goals for all of our Plymouth County legislators, Democrats and Republicans, to really tackle issues that relate to substance abuse prevention. One of the first things we've already done just in the House budget, we've talked about it before right here on SCTV, is we were able to get another $100,000 to fund a thing called Interface, which will help people when folks could be in crisis either for mental health issues or concern for substance abuse, if they're looking to get a loved one to get counseling. It's so frustrating, John, that if you finally get by the stigma that's out there about either disease or a condition that affects the brain. If someone has cancer we would scream from a rooftop, my loved one needs help, we're going to get them the best care. If someone has diabetes, we say, you know what, we're going to come up with a regimen so we'll help that person, so there'll be one specialist that can help them learn about a new diet. There might be another person that works about how that healthy lifestyle is working out. When it comes to substance abuse, there's a lot of reticence in the way society, up until now, would treat it, had a great stigma to it. And I'm proud to say that we are making steps already. To very briefly tell people for updates, so we have funding there to help people for counseling. We're looking, Judge Siobhan Foley here from Scituate has so many wonderful ideas of what we should do to look for long-term treatment. We just passed a bill that doubled the amount of time that insurance companies have to pay when someone gets into a treatment center. But even that, frankly, is not enough. It's a nice step. But going from the very beginning, we've been meeting with doctors. We met yesterday with the CEO for what I call Jordan Hospital. And later in the day was meeting with folks from South Shore Hospital of how our doctors from the beginning need to be thinking when someone comes in and says that they have pain, or if they have a knee operation or dental work, whatever the circumstance, that we now have to rethink about what gets prescribed. That we, at the very beginning, have to say, you know what, there may be other things that are less addictive that can do the trick, that can make you, perhaps you'll still have some discomfort, but you're not going to have the worry of having a long-term situation where you're now going to be addicted. So starting with doctors, we're working hard to make sure for our new training of doctors that we're going to have a component for every new doc as they're getting licensed is going to learn about things that relate to pain management and how we try to avoid using opiates. There are many people who absolutely legitimately need opiates, so we're trying to make sure that when they're prescribed that they give them a lesser amount. And again, fighting insurance companies, so if you give them a lesser amount and they say, you know what, I used them up and I still need just a few more, that they don't get hit with high deductibles all the time. So we're working hard on that. We have a thing called a prescription drug monitoring program, national model, that I will tell you, Anne Marie Galvin was one of the people at the forefront of this, that now when, we just passed legislation a little over a year ago, that when someone goes to a doctor and has an opiate prescribed to them, that doctor is to put it into the computer system, this monitoring system. So then if I'm the person that had the opiate and I decide that I want to try to doctor shop, so I go to Dr. Liz Charlton and I go to her and I try to get another opiate, the doctor would look and say, you know what, we just saw that you had this that was given to you just last week. You had 30 pills. It stops that doctor shopping. We're doing new things about prescription monitoring pads so people can't write those. It runs the gamut, John, and we'll come back time and again because what you do, focusing and covering what Scituate Facts is doing every single month with multiple meetings, it's important for us to keep reinforcing that this is a public health crisis. We need a lot of attention, and it's something that I'm very pleased to work as a partner with all these others to try to make a difference.
That's great news, and we'll provide some information at the end of this interview for people that want to learn more about Scituate Facts.
That's fantastic. Because Scituate Facts, one-stop shopping, they can learn everything they need to learn.
They do a great job, and we support them in any way we can. We actually have several students here at SCTV all the time, right. At one point or another, and we talked a little bit about preparing for college, right. College tuitions, right. And being in that situation as a young person going in and what college costs, right. Is a very serious issue and a very topical issue for many people.
It certainly is.
And so maybe you could bring us up to speed on some of the things that you're working on regarding this situation for young
John,
people.
No, thank you. Both Courtney and Steve are here and we were talking offline just about the cost of college, and it is one of the items that really is the budget buster for middle class America. That we think the American dream is always that you'd be able to live in Scituate, have enough money to pay for your home, have enough money to put your child or your children through college, and then have money for retirement. And it's clearly one of the most challenging things now that we have is the cost of college that is an impediment to people being able to have the American dream. So what we've been working on the last 3 years at the state level, we froze state tuition for all the state colleges. And it's something that in our budget this year, the House budget, we intend to try to do the same. In doing that, what we're hoping to do is create pressure that will affect the private colleges as well, because as people are shopping around, they're looking for their best dollar, best bang for their buck. And if the state colleges stay, right now UMass Amherst, I'd have to ask Courtney, but I think UMass Amherst is around $22,000 a year. still expensive, but for the excellence in education. My wife went to UMass. Both my nieces, one niece is graduating today as we, Shannon Cantwell's graduating right now, my brother's out there. Great education that young people have, but we have to make sure that debt doesn't make decisions for them after that they can be able to go out and be able to succeed in whatever profession they choose. So that's the first thing we're doing is trying to make sure we continue to freeze state tuition. The other thing that, I use a medical analogy often for private colleges and for the state colleges. What we found is one driver for medical costs, well, when every single hospital decided that they wanted to have the very best technology for, like an MRI. MRI is actually more common, but think of other technology that would not necessarily be needed at every single hospital, but you could have some specialties. Now, this wouldn't be for your emergency rooms. We want to have the best technology everywhere. But for selective surgery, we can keep medical costs down if we have different hospitals that have their specialties. Let me turn that over to for colleges. Every single college doesn't need to have the $80 to $100 million new science facility. Boston College, where I went to, put a new facility there, and we're not really known for science, but it was I always have things that get sent to me as alumni, and I'm saying that's wonderful. However, that building's going to cost a lot of money for students to be able to afford to go. So that's what we're trying to do, is to create a manner that if our state colleges are less expensive, all the private colleges will have to compete in that manner, and hopefully we'll be able to keep those costs down. The other thing we do, Senator Elizabeth Warren, you and I just were talking when she was here helping us and meeting with us all about coastal erosion issues and trying to get funds. We, by the way, have $8 million that is due to us from Hurricane Sandy that we're fighting to try to get, just as a reimbursement. But across the board, when young people are borrowing to go to college, it's unconscionable that they could have to pay 8% interest when we look across the board for all of us in the financial field that we know interest rates now are 3s and 4s. So that's something that with the pressure, it really is more of a federal issue, but it's to work with our federal delegation to push up and say, you know, we need to help these young folks, help their parents be able to afford going to college.
Yes, absolutely agreed. And just as we wrap this up, we always like to provide information on how people can get in touch with you.
Sure.
Office number, email.
So anytime when there's an issue, and I know we've touched upon matters here, but if there are things that in the short amount of time here we can't cover everything. If there's something of interest to you and you want to talk to me, you can either call directly at 617-722-2140, or my email is james.cantwell@mahouse.gov. Website's pretty simple, just my name, just www.jimcantwell.com. You can write to me there as well. I appreciate the opportunity coming in, John, and there's always going to be more material for us to talk about, but thank you for the invitation.
That's right. Thank you very much.
Thank you so much.
Good to see you.